Okay, so we're going to take some time and organize some of the thoughts on the joints chapter and then talk about how to best remember things, because it's tempting to try to memorize it all, but realistically you have all the parts pieces, just move them and see what they do. So first off, let's talk about ways you can classify. So you can classify them based on their function, so that's their range of motion. Or you can classify them based on their structure. So that would be, what material do you put between those bones? Because when we talk about a joint or an articulation, it's really where two bones meet. So let's talk functional classes first. So the best way to remember things is to make a story, translate it, come up with a mnemonic. So I go with sad. And that will also put you in the order from no movement down to free movement. So you have synarthrotic, amphiarthrotic, and diarthrotic. So no movement, slight movement, not enough that you would see it or be able to perceive it. And then diarthrotic, which are the ones that you really picture or think of when you're like, oh, I'm studying the joints, so the things that move around. Now, there are also 3 structural classes, again, based on the material that you have between the joints. You can put fibers between things, so it would be your fibrous joints. You can put cartilage between things. Or you can put synovial fluid between them. So it's very tempting to try to pair these up, but they don't match perfectly, except for here. All diarthrotic joints are synovial. If you're holding the joint together with fluid in between them, they're definitely going to move. You're going to have an increase in range of motion here. And as far as subcategories, that range of motion can be different depending on the setup and how many planes that they act in. So real quick, let's talk about your different types of synovial joints. So starting with the ones that are uniaxial, they work in only one plane. You would have a plane, which is also called a gliding joint. You would have a pivot joint, or you would have a hinge. So a plane would just slide back and forth. So these two surfaces are flat on flat. You would see this like the carpal bones on the wrist. So flat surface on a flat surface sliding. They're not going very far, but each individual one can add up to make some things happen. A pivot is a twist. So atlas and axis, the dens of the axis sticking up and the atlas wrapping around it, sliding side to side. So it's allowing you to turn your head just like this, like saying no. A hinge, so I guess I should probably, so glides, pivot was a rotate movement. And then over here with the hinge, you can flex and extend. It basically is like a hinge on a door. You can open and close. And that's it. So that would be like the elbow. You can just do this. So again, do the movement, see what you can come up with. So uniaxial, they can only do movement in one plane. What I mean by movement in one plane, remember your 3 major planes? So you have the sagittal one that splits you in a front and a back. A hinge only works in that plane. They only go forward and backwards within that plane. A pivot would twist within the transverse plane. Now this is the one I'm using here. It's just an example of rotation, but it's not a really good one because it actually is a multi-axle. You can do more there. So let's come down here. It's a little bit harder to see, but I can twist here. That's the head of the radius pivoting around that notch that's in the ulna, allowing you to pronate and supinate. And so you're just twisting within that transverse plane. And then your plane one, the plane that you're working in, or the gliding ones, that really just depends on where those flat surfaces are. But you're still not going very far, and you're only working in one direction. This is different than something that would be classified as biaxial. Biaxial meaning you're working in 2 planes. So if you have something that can flex and extend, but also go in and out, so if you're staying in the anatomical positioning here, so I'm trying to like squeeze it up here, we're going forward and backwards and side to side. So side to side, abduction, adduction, bringing it back in, flexion forward, extension back. That's 2 planes. So you're working within the frontal plane by going side to side, and you're working the sagittal plane by going forward and backwards. And so with a biaxial, you can work in those two. So biaxials can do flexion and extension, and they can do ab and adduction. And there's 2 subcategories here. You have an ellipsoidal, also known as condylar, you can use either. And then the other one is a saddle. Structurally a little different. They do the same jobs. Ellipsoidal, you can rock side to side, front to back. The difference with a saddle, you rock side to side, front to back, is that you have a convex and concave side locking in. So it looks like a saddle sitting on top of a saddle. And then the last one is a multi-axial. Category. And with a multi-axial category, this is your ball and socket. You can work in all of your planes. So you have the ability to not only go forward and backwards, so flex and extend, not only out and in, so abduction, adduction, you can also now pivot. So now we're staying in that transverse plane. So you went in that sagittal plane, you're going in that frontal plane, and now you're adding the transverse plane. Now do be aware of the fact that anytime you can work in at least 2 planes, you also have the ability to circumduct. You can add up those planes and make circles. That's different than rotation. Rotation stays put within that transverse plane. Circumduction breaks all of your planes, so those are different. So anytime you have at least a biaxial or multi-axial, you do also have the ability to circumduct. So multi-axial, we can flex, extend, add an ab. But now you also get rotation, and you still have circumduction. So what's each of those letters mean? So those are your synovial joints, a lot of different ones. These are the ones that you think of when you think of moving. So again, move your body, see what you can do, and then you can put yourself in a category based on what actions you have. Now there is an extra saddle joint that doesn't fall into the flex extend, and that's actually from here where the sternum and the clavicle meet. You can elevate and you can depress. So you're working one plane there. You can protract, push forward, and you can retract. So it's another plane here, and you can add it together and make a circumduction. But that's only working in 2 planes where you actually stay within and then breaking all of them. So there isn't a rotation there, so that puts that as a biaxial, and it does have a saddle anatomical setup. Okay, now let's come back up to these ones. Now, as I mentioned before, it'd be tempting to pair them, but it doesn't work out that well. There are subcategories in each of these that fall into either one of these. So for example, under cartilaginous, you have 2 types of cartilaginous joints based on the type of cartilage that you're going to use. Now, remember there are 3 types of cartilage: elastic, fiber, and then hyaline. You wouldn't use an elastic cartilage in between bones because it's not like a go-go gadget situation, although that would be cool. You don't get to stretch and then like snap them back. So we'll only use fibrocartilage and our hyaline cartilage, our base model. And so if you're using the hyaline cartilage, that would be a synchondrosis joint. And those don't really move. So it would fall as being synarthrotic. So synchondrosis, those are the ones made with hyaline cartilage. They only fit under synarthrotic. They don't move. So it would be like connecting the sternum to the ribs using the costal cartilage, for example. Your other cartilaginous joint, which is made out of fiber cartilage, actually does allow for some movement. This is a symphysis. So a symphysis joint does have some movement, and this would be like the pubic symphysis, for example, between the 2 pelvic bones. There's some slight give there. Okay, now that we have the cartilaginous ones out of the way, so I can draw the fibrous ones, let's talk about those. There are 3 subcategories under the fibrous ones. 2 of them would be non-moving ones, but there is one that does allow some slight movement. So the one that allows some slight movement here is called a syndesmosis joint. You see this in between the shafts of your bones in your forearm, between the ulna and radius, or between the shafts of your tibia and fibula, kind of help holding them in position, but they do have a little bit of give as those joints that are neighboring it move around. You also can have some that don't move at all, like your sutures. So sutural joints, like where your skull bones meet, so like the sagittal suture, coronal suture, lambdoid suture that you learned when you learned bone names, those are joints that are not going to move. And then another one that doesn't move is a gomphosis. That's a tooth in a socket, so it stays put, shouldn't be wiggling around, especially, well, if you have an adult teeth. I currently have a 6-year-old with a lot of wiggly teeth and a couple of tooth holes, we call them. But in adults, stationary, not going anywhere, hopefully. All right, hopefully that helps to organize your joints. Again, move your body around. Don't just try to memorize stuff. Do the motions, see what you have going on, how many planes you're working in, and narrow it down to the categories based on what you're experiencing. All right, take care.